day everyone, my name is Piet Jacobus and I'm an editor with Healthcare Innovation. We are at HIMSS today and it's my pleasure to be speaking with Mike Cordero, Senior Director, Interoperability, Market and Product Strategy at Meditech. It's great to see you, Mike.
Great to see you. Thanks for talking to me.
Absolutely. So how has interoperability evolved from a compliance requirement to a strategic advantage for health systems?
Interoperability has definitely evolved from that regulatory checkbox to a strategic lever, right? It's an opportunity to improve performance, growth, enable patient empowerment. So interoperability is foundational to a solid strategy for any healthcare organization. And at Meditech, we definitely invest a lot in our interoperability offerings and actually our infrastructure and how we use data, right? So we're leveraging data exchange frameworks like TEFCA. We're ensuring that our infrastructure is FHIR enabled and scalable. We're ensuring that we're providing technology to all health systems and ensuring that we have equity. So at Meditech, we support a lot of community independent rural hospitals, so we want to make sure that they have the opportunities any other larger institutions might have. So interoperability is a foundational infrastructure to expand as a platform.
How has Meditech approached interoperability differently than other vendors in the market?
One of the things is that interoperability is part of our core infrastructure, our core DNA. We believe that interoperability is a mechanism to advance health IT. We believe in the fact that we define an ecosystem by which health IT can innovate around Expanse as a platform. We believe in open standards, and that is a mechanism by which we're continuing to able to ensure data is flowing, right? Health systems have access to data to treat patients. Patients have access to data to empower their own care journeys, navigate where their data goes and how they can navigate the health system. And importantly, interoperability is foundational to how we're getting data to power advanced technologies like AI and other features and tools that we enable in the platform.
Rural healthcare is facing more challenges than ever before. How does a strong interoperability strategy help rural providers advance health equity, strengthen care coordination, and remain independent in an increasingly consolidated healthcare landscape?
I think interoperability there is a lifeline for rural health. It's ensuring those rural health organizations actually have access to the data they need to ensure that they're making the right decisions for those patients. Those organizations are treating patients over a vast geography. And these patients potentially are going to large academics in urban areas, and interoperability is a mechanism by which those care teams have access to the data, those referral loops are closed, and again, more importantly, it's the mechanism by which we're giving patients tools to power their own healthcare journey. So in my opinion, it's foundational. Frameworks like TEFCA are necessary in order to support rural communities and ensure that there isn't data lock-in. So I think it's a strategic lever for those organizations.
So how is Meditech leveraging interoperable data within the EHR to deliver meaningful insights for healthcare organizations, and how are those insights presented in ways that are actionable for clinicians and leaders?
Yeah, I think that's a great question, because from an interoperability standpoint, it's more than just connecting edge devices or edge systems, right? It's about making sure that data lands, that we're not just sharing data, we're sharing information with context to the right person. And so in order to do that, we know that a patient is receiving care not just in a single health system, and that their health history exists outside of kind of a single ecosystem. Leveraging frameworks like TEFCA, we're able to build out that longitudinal care record. We're able to take that data, and based on that investment we make in our infrastructure and that FHIR first approach we have, we can move that data over to large language models, AI agents to help make sense of that data within workflow and deliver those insights directly to those clinicians when they need it.
So how has EHR interoperability have become more essential with the introduction of AI technologies, which often rely on data exchange?
Yeah.
And what are some of the ways Meditech is leveraging AI and its interoperability to meet some of those challenges?
So we're leveraging AI across our platform, and I think one of the things that I would love for folks to just appreciate is Expanse is a platform that's enabling technology. AI in various forms, agentic, generative. These are all tools that are baked directly within the platform and can be turned on in various workflows. So, and that's paramount because we're leveraging AI, to generate discharge summaries. We're leveraging AI to make sense of large narrative text for clinicians. We're leveraging AI to ensure clinicians can interrogate the patient record and get those insights and those salient data points. We're leveraging AI to empower the patient, help them schedule their appointments, help them make sense of the last episode of care, and help them prepare for their next appointment with a specialist. I think as our industry continues to evolve, AI is going to be infused in more and more workflows and maybe shift from just being passive to more active in workflows in different care settings.
Oh, absolutely. So the patient experience is a critical driver of health outcomes and a hospital's financial performance.
Yeah.
How does Meditech leverage interoperability to improve the patient experience through streamlined communication, access to health information, and connections with consumers' preferred devices?
One of the things, I've been working in Interop for quite a while for Meditech, and I think that one of the key points we've always focused on is empowering the patient and how the patient should actually be the orchestrator of their health information and their data. And so when we're looking at how we're infusing technologies like AI into the patient experience, it's just exactly for that. It's mechanisms to ensure that we can use things like individual access services to enable patients to have access to their data. We're leveraging AI to help patients integrate and create a single patient record in an integrated fashion, and then be able to use that patient record and use AI models to help make sense and summarize some of the information. So patient empowerment is kind of the forefront of a lot of our patient engagement strategies and tools, and that's where we invest heavily. We believe in frameworks like TEFCA and individual access services as mechanisms to do that.
It's very good to hear. So patients are increasingly seeking their personal health data to create a consolidated history of care received from all their providers, regardless of the health system. How has Meditech incorporated the patient experience in the interoperability strategy to provide seamless access to the health information?
I'm really proud of a lot of the work we do around patient empowerment, and I think that anyone that is participating in this healthcare conference or any other place can see us actually demonstrate these things live in real time. We're participating with the industry in various groups, defined by CMS, for instance, technology framework, in other areas to continue to advance the work we're doing here. Enabling patient access apps to gain access to the patient's record that exists within a Meditech instance, facilitate those data exchanges, make sense of those data exchanges, and provide the patients with those patient engagement tools like scheduling, like AI agents to help navigate their care journey as empowerment tools. So I think that as you continue to kind of walk through the conference and have an opportunity to speak to any of my colleagues or kind of visit any of our booths, you'll see that in real world production.
Wonderful. Thank you so much, Mike, for your time.
Thank you for talking to me.
Yeah, enjoy the show. Thank you, everybody, for tuning in.